happens if you don't masturbate? This one is a question I get asked so often in my clinic, you won't believe it. People come in, sit down, look left, look right, make sure nobody is listening, then whisper to me like they're sharing some government secret. Dr. Cheryl, I stopped doing it for 2 weeks already. Is something wrong with me? Am I going to have problems? I always tell them, relax lah. Let's talk about this properly. I'm Dr. Cheryl Lim and I've been practicing urology here in Singapore for more than 20 years now. I've seen thousands of patients walk through my door at Mount Elizabeth, Gleneagles, you name it, from young NSF boys worried about their SAF medical checkups to uncle retirees wondering if their equipment still works properly. And let me tell you, this topic of masturbation, it sparks so much discussion, so many misunderstandings, and honestly, a lot of unnecessary worry. So today I want to address this question properly. What actually happens to your body if you don't masturbate? Is it dangerous? Does it have benefits? Are there emotional, psychological, or physical effects? We're going to approach this from a professional and scientific angle, but I'll keep it real with you, okay? No need for all that medical jargon that makes your head spin. Let me start with some context first. Men of all ages and backgrounds masturbate. This is not a Singapore thing, not an Asian thing, it's a human thing. Studies show that more than 90% of men have masturbated at some point in their lives. 90%, okay? So if you're sitting there thinking you're the only one, trust me, you're not alone lah. But here's the thing, some people choose not to do it. Maybe it's personal preference, maybe it's religious beliefs, maybe you're trying out that no FOB challenge you read about online, maybe you're just too busy with work, taking care of grandchildren, or playing mahjong until 3 in the morning. Whatever the reason, it's a personal choice and I respect that. What I want you to understand is that this choice can have both emotional and physical effects on your body. Some people may experience stronger effects, while others may barely notice any changes at all. Everyone is different and your body is unique. What works for your kakis at the kopitiam may not work for you. Now, before I tell you what happens when you stop, let me explain why masturbation can be beneficial in the first place. This way, you'll understand the full picture. First one, prostate health. This one is important, especially for you older gentlemen watching. Your prostate gland produces seminal fluid, and regular ejaculation, whether through masturbation or sexual activity, helps to flush out this fluid. Think of it like this lah. You know how if you don't use your car for too long, the engine can get problems? Similar concept. When seminal fluid accumulates in the prostate, it can cause discomfort and potentially lead to prostatic congestion. Some research, including a well-known Harvard study, suggests that men who ejaculate more frequently may have a lower risk of prostate cancer. Now, I'm not saying masturbation is a magic cure, but the association is there in the data. Second benefit is stress relief and relaxation. When you masturbate and reach orgasm, your body releases dopamine and endorphins. These are your feel-good hormones. Same chemicals that get released when you eat your favorite char kway teow or finally win that 4D number you've been buying for years. These substances improve your mood, reduce stress, and promote overall well-being. For many men, especially those dealing with work pressure or family stress, this release is a healthy way to cope. Third one is self-awareness. Through masturbation, you learn what feels good for your body. You understand your own responses and preferences. This knowledge is valuable, especially when you're with a partner. You can communicate better, enjoy intimacy more, and develop a healthier relationship with your own sexuality. Nothing shameful about knowing your own body, right? Fourth benefit is improved sleep. During orgasm, your body releases oxytocin and prolactin. These chemicals promote relaxation and can help you fall asleep faster and sleep more deeply. Many of my patients tell me they sleep like a baby after. So if you're having trouble sleeping at night, well, you know what to do lah. Okay, now let's get to the main question. What happens if you stop masturbating? Let me be clear about something first. Not masturbating doesn't mean your body will suffer permanent damage or experience lasting negative effects. Every person is unique. Some men actually feel better when they abstain. So don't panic if you've decided to stop, but there are some changes you might notice, and I want to explain them properly. The first physical effect is on your prostate health. Like I mentioned earlier, regular ejaculation helps maintain prostate health by preventing fluid buildup. If you abstain from masturbation and you're also not having regular sex, you may be at slightly higher risk for prostatic congestion. This can cause discomfort in your pelvic area, a feeling of fullness, or even mild pain. Men who abstain completely tend to experience these more frequently. I had a patient last year, Mr. Tan, 62 years old, retired civil servant. His wife passed away 2 years ago, and he told me he hadn't ejaculated in over 6 months. Felt very uncomfortable down there, thought he had cancer. After examination, turns out it was just congestion. I told him, "Uncle, your body needs release one way or another." He was so relieved to know it wasn't anything serious. The second effect relates to hormones, particularly testosterone. Now, this one is interesting. When you abstain from masturbation, your testosterone levels don't drop significantly. In fact, some studies show a temporary spike in testosterone after about 7 days of abstinence. This can lead to increased libido, heightened sensitivity to sexual stimuli, and for some men, a general feeling of increased energy. But here's the catch. This effect is temporary. After a few days, testosterone levels return to baseline. So if you're thinking of not masturbating to become some kind of super virile man, it doesn't quite work that way lah. Some men notice these changes. Some don't feel any different at all. It's not a universal experience. The third physical effect is wet dreams, or what we call nocturnal emissions. In medical terms, if you don't masturbate and you're not having sex, your body will find its own way to release accumulated sperm. This usually happens during sleep. You wake up in the morning and there's a wet spot on your underwear or bed sheets. Don't be alarmed if this happens. It's completely natural and healthy. Your body is simply doing what it needs to do. It's like a pressure release valve, you know? The reproductive system is designed to maintain itself, and wet dreams are part of that process. During my NS days, so many young recruits would come to the medical center worried about this. I'd tell them, "Bro, your body is just doing its job. Go change your underwear and carry on." Now let's talk about the emotional and psychological effects, because this is where things get more varied and personal. The first psychological effect is increased irritability and stress. Many men use masturbation as a way to cope with sexual tension and emotional stress. It's a release valve, not just physically, but mentally too. If you take away this outlet without replacing it with something else, you may find yourself feeling more on edge, more easily frustrated, shorter temper with your wife, your children, your colleagues, I see this sometimes with patients who try to quit cold turkey without any other coping mechanisms in place. They come back after a few weeks saying, "Doctor, I don't know why, but I'm so irritable lately. Everything also can make me angry." And when we dig deeper, turns out they stopped masturbating and haven't found another way to manage their stress. The second psychological effect is increased sexual tension. If you don't release sexual energy through masturbation, that energy doesn't just disappear. For many men, the intensity of sexual desire increases the longer they abstain. You may find yourself more sensitive to sexual stimuli. A pretty woman walks by and wow, your heart beat faster. You see a slightly suggestive advertisement and suddenly you can't concentrate. Some men find this frustrating and distracting. Others actually enjoy this heightened state. They see it as a challenge, a way to exercise self-control. Some even claim it motivates them to be more productive in other areas of life. This is very individual and there's no right or wrong way to experience it. The third psychological effect is something that surprises many people. Some men report feeling more energetic and mentally clear when they abstain from masturbation. They say they can focus better at work, feel more motivated, and have more drive to achieve their goals. Now, I want to be honest with you. The scientific evidence for this is not as strong as some internet forums would have you believe. But anecdotally, I've had patients tell me they feel sharper and more productive during periods of abstinence. Whether this is a placebo effect, a result of redirecting sexual energy into other activities, or genuine physiological response, we're not entirely sure. But if you experience this benefit, then good for you lah. The fourth psychological effect, and this one is important, is the impact of myths and misconceptions. So many men carry unnecessary guilt and shame about masturbation because of things they heard growing up. You'll go blind, hair will grow on your palms, you'll become infertile. All these are complete nonsense, okay? Old wives' tales that have no basis in medical science. These myths can prevent you from having a positive relationship with your own sexuality. They can make you feel ashamed about something that is completely normal and natural. And when you decide to stop masturbating, sometimes these same myths create anxiety about what will happen to your body. Let me clear up some of these myths right now. Myth number 1, sexual performance is improved by abstaining from masturbation. People say if you don't masturbate, you'll perform better in bed. Fact, this is not supported by evidence. masturbation has no negative impact on sexual performance. In fact, regular masturbation can help maintain erectile function and helps you understand what feels pleasurable, which can actually improve your performance with a partner. Sexual performance is more related to your stress levels, emotional connection with your partner, cardiovascular health, and overall physical fitness. Myth number 2, not masturbating will affect your fertility. Some men believe that if they masturbate too much, they'll run out of sperm, or if they don't masturbate, their sperm quality will improve. Fact, your body continuously produces sperm. Masturbating doesn't deplete your reserves in any meaningful way, and abstaining doesn't significantly improve sperm quality either. Fertility is influenced by many factors, including diet, exercise, age, genetics, and overall health. Whether you masturbate or not has minimal impact on your ability to father children. Myth number 3, masturbation causes erectile dysfunction. This is a big one that worries many men. Fact, normal masturbation does not cause erectile dysfunction. In fact, regular sexual activity, including masturbation, can help maintain healthy erectile function by promoting blood flow to the genital area. Erectile dysfunction is usually caused by other factors such as cardiovascular disease, diabetes, hormonal imbalances, psychological issues, or side effects from medications. Myth number 4, you can masturbate too much and become addicted. Fact, for most men, masturbation is a normal, healthy activity. However, like anything in life, moderation is key lah. If masturbation is interfering with your daily responsibilities, your relationships, your work, or causing physical discomfort, then yes, it may be worth examining your habits, but occasional or even regular masturbation is not the same as addiction. Don't let anyone shame you into thinking normal sexual behavior is problematic. One of my patients, Mr. Go, 71 years old, very conservative man, told me he felt guilty every time he masturbated because his late mother told him it was sinful. He's been carrying this guilt for over 50 years. Can you imagine? 50 years of unnecessary shame over something completely natural. We had a long talk about it, and I could see the relief on his face when I explained the medical reality to him. Now let me share some practical tips for maintaining good sexual health, regardless of whether you choose to masturbate or not. First, listen to your body. Everyone has different needs. If you decide not to masturbate, pay attention to how your body responds. Notice any changes in your mood, your energy levels, your sleep quality, your stress levels. If you're experiencing significant discomfort or distress, it may be worth reconsidering your approach. Second, communicate openly. Whether it's with your partner, your doctor, or even just yourself, don't be afraid to address sexual health concerns. Many men of our generation, especially in Asian cultures, we grew up not talking about these things, but silence doesn't solve problems. It only creates more confusion and worry. If you have questions, ask. If you have concerns, voice them. There's no shame in wanting to understand your own body better. Third, maintain overall physical health. Your sexual health is closely connected to your general health. Eat a balanced diet. Exercise regularly. Even just walking around the neighborhood or going to East Coast Park can make a difference. Manage your stress through activities you enjoy, whether it's Tai Chi, gardening, or spending time with your grandchildren. Get enough sleep. Cut down on alcohol and cigarettes if you can. All these things contribute to better sexual function. Fourth, don't believe everything you read online. The internet is full of extreme claims and miracle solutions. Some websites will tell you that not masturbating will give you superpowers. Others will say masturbating every day is essential for health. The truth is usually somewhere in the middle. Be critical of what you read, and when in doubt, consult a qualified medical professional. Fifth, find balance. This is perhaps the most important advice I can give you. Both masturbation and abstinence have their advantages and disadvantages. The secret is to find what works for you personally. Some men feel best with regular masturbation. Others prefer to abstain for various reasons. Neither choice is inherently right or wrong. What matters is that you're comfortable with your decision and that it supports your overall physical, mental, and emotional well-being. I want to address something else that I think is particularly relevant for older men watching this. As we age, our bodies change. Erections may not be as firm or as frequent as they used to be. Orgasms may feel different. Recovery time between sexual activities increases. This is all normal, okay? It's part of the aging process. Some men respond to these changes by reducing or stopping sexual activity altogether, including masturbation. They think, oh, I'm old already, no need for all this. But here's what I tell my patients. Sexual health is health. It doesn't have an expiration date. Maintaining some level of sexual activity, whether with a partner or through masturbation, can actually help preserve function as you age. Use it or lose it, as they say. Of course, if you have underlying health conditions, take medications that affect sexual function, or experience significant changes in your sexual health, please consult your doctor. Don't assume everything is just old age. Sometimes there are treatable causes that we can address. Let me also say this. For those of you who are widowed or no longer have a partner, masturbation can be a healthy way to maintain your sexual health and enjoy physical pleasure. There's nothing wrong with taking care of your own needs. You're not being disloyal to anyone's memory. You're simply being human. Before I wrap up, I want to acknowledge something that one of my colleagues mentioned to me recently. He said, Cheryl, you know what? When it comes to this topic, people just want to know that they're normal. And I think he's right. So let me tell you clearly, whatever your relationship with masturbation, whether you do it daily, weekly, occasionally, or not at all, you are normal. As long as it's not causing harm to yourself or others, as long as it's not interfering with your life and responsibilities, you're fine. The human body is remarkably adaptable. It can handle periods of abstinence just as it can handle regular sexual activity. What it doesn't handle well is shame, guilt, and misinformation. So let go of the myths, let go of the judgment, and make decisions that feel right for you. Remember, I've been doing this for over 20 years. I've talked to thousands of men about this exact topic. You are not alone in your questions and concerns. This is part of being human, part of being a man, and there's no shame in wanting to understand it better. So to summarize, not masturbating is not dangerous. Your body will adapt. You may experience some physical effects like prostatic congestion or wet dreams. You may feel more irritable or have heightened sexual tension, or you may feel more energetic and focused. Everyone is different. The key is to pay attention to your own body, separate fact from fiction, and make informed decisions about your own health. If you have specific concerns, if something doesn't feel right, if you notice significant changes in your body or your well-being, please don't hesitate to see a doctor. Don't be paiseh about it. We've heard everything, seen everything. Nothing you can say will shock us. It's our job to help you, and we're here for you. Take care of yourselves, gentlemen. Your health is your wealth, as we like to say in Singapore. Whether you choose to masturbate or not, the most important thing is that you're making that choice with accurate information and without unnecessary fear or guilt. This video is meant to educate and inform, but it's not a substitute for personalized medical advice. If you have concerns about your sexual health, please consult a qualified healthcare professional who can assess your individual situation. And remember, it's never too late to prioritize your health and well-being. Until next time, stay healthy, stay informed, and don't believe everything your kakis tell you at the kopitiam. Some of them really talk nonsense one.